Everyone, welcome back to Dr. My Share Medical Knowledge channel, your source for all things medical. Today, we're going to dive into the amazing way your body protects you from germs and what happens when that system breaks down in cystic fibrosis. Have you ever walked into a crowded restaurant and taken a deep breath, enjoying the delicious smells? You probably didn't think about it, but with every breath, you're inhaling thousands of bacteria and viruses. So, why aren't we sick all the time? It's all thanks to your respiratory tract's incredible defense system. In your respiratory tract, there's a thin layer of mucus that traps bacteria and viruses. This mucus is constantly swept upward by tiny hair-like structures called cilia. Together, they form the mucociliary system, which works like a self-cleaning oven for your lungs. If everything is working well, you might cough or sneeze out the dirty mucus, or it might get swallowed and destroyed by stomach acid. But when this system is disrupted, that's when you start to get sick more often. A prime example is cystic fibrosis. In this condition, the mucus becomes super thick and sticky, making it hard for the cilia to do their job. This leads to severe respiratory infections and can even cause airway blockages, making it hard to breathe. So, what causes the mucus to become so thick? It all comes down to a tiny protein in your cells called CFTR, cystic fibrosis transmembrane conductance regulator. Normally, CFTR acts like a gate for chloride ions, letting them move from the cell into the mucus. But in cystic fibrosis, mutations in the CFTR gene mean that the protein is misshapen or missing. Without chloride ions moving out, there's an imbalance of sodium ions, which draws water out of the mucus, making it super thick. This thick mucus can cause blockages and lead to those severe respiratory infections. Let's talk about how this works in simple terms. Imagine a U-shaped tube with different amounts of salt on each side. Water will naturally move to the saltier side through a process called osmosis. In cystic fibrosis, the cells become the salty side, and the mucus becomes dry and sticky. This causes mucus to build up, leading to blockages and infections. CFTR doesn't just affect the respiratory tract. It also plays a role in the digestive system, where thick mucus can block ducts that carry enzymes from the pancreas and bile from the gallbladder. This can lead to malnutrition because your body can't break down food properly. And in the sweat glands, defective CFTR leads to a buildup of chloride ions, creating salty sweat, a common symptom of cystic fibrosis. The good news is that advancements in medicine have increased the average life expectancy for someone with cystic fibrosis from 14 years in the 1980s to over 40 years today. Treatments like antibiotics, digestive enzyme supplements, and medications that break down mucus or dilate the airways have made a huge difference. However, these treatments address the symptoms, not the root cause. Researchers are working on medications called CFTR potentiators, which aim to restore normal CFTR function. However, these only work for about 5% of people with certain CFTR mutations. So there's still a lot of work to be done to find a cure for everyone with cystic fibrosis. If you'd like to learn more about cystic fibrosis or support research for a cure, check out organizations like Cystic Fibrosis Canada or the Cystic Fibrosis Foundation. Thanks for tuning in to Dr. My Share Medical Knowledge channel. Don't forget to like, comment, and subscribe for more medical insights. See you next video.